Patients actively want to participate in their health. As a result, communicating back and forth with them is super easy since they prioritize their doctor, and we can all sing Koombayah. Now obviously that statement is completely false, although it does sound nice. If you're a healthcare professional, you know that sometimes patients aren't the easiest people to contact. You would think that they'd have a sense of urgency when it comes to staying in contact, but sometimes they just don't have the time or they're stubborn. It's your responsibility to keep them up to date on everything related to their health though. This is especially true after they've had an appointment with you, but this isn't easy. The reality is that almost 70% of Americans say that it's their general practice to not answer the phone. Maybe that statistic isn't that much of a surprise to you considering all of the modern day communication alternatives that exist. Yet AT&T found that the number of cellular calls rose by 35% in 2020. What I'm trying to allude to is that at some point or another, you're going to have no choice but to leave a voicemail for your clients. Now that might not sound like that big of a deal. After all, people have left voicemails for each other since the original machine came out in the 1960s, but what you say in your recorded message could lead to massive consequences according to the Health Insurance Portability and Accountability Act if you're a healthcare provider. Hi everyone, I'm Matt from eTactics, and today I'm going to explain 4 secrets for leaving a HIPAA-compliant voicemail. Before we get started though, make sure you subscribe to our YouTube channel by clicking the button below. While you're down there, hit that alert bell icon next to it as well so when we post new helpful content, you get notified. The first secret is that you need to know what's allowed. It isn't reasonable to prohibit healthcare providers and other covered entities from using voicemail altogether. If that were the case, it would severely impact the ability of the entire industry to adapt to technological advancements in general. Trends like telehealth wouldn't even exist if that was true. According to the Department of Health and Human Services, you may leave a voicemail for your patients. Surprisingly, the HHS provides a clear-cut yes in this scenario and reaffirms the ability to leave messages for patients on their answering machines as well. However, that doesn't mean that the doctors can call up their clients and blabber on about every little detail of their upcoming or previous appointments. Covered entities should ensure that they limit the amount of information that they disclose in a voicemail. HHS recommends only sharing names, numbers, and appointment confirmation details. The second secret is that you should create a script. The majority of business that occurs over the phone uses a script, yet only the scripts that aren't obvious see success. A 2018 study found that customer experience improves when they don't realize the use of a script to lead the conversation. Why not use a similar concept to ensure you're leaving HIPAA-compliant voicemails? Third, show emotion and be genuine. A study from Additional Gold Foundation found that when doctors show empathy toward their patients, it improves health outcomes. Yet a separate study confirmed that physicians became less empathetic the longer that they work in the industry that they serve. I put these 2 studies together to emphasize the point of this section, not to say that you're heartless if you happen to be a doctor. This section exists to explain the importance of showing empathy and being genuine in the voicemails you leave for your patients. Yes, having a script ready just in case your client doesn't answer the phone is something you should have. Yet you don't want to come off as inauthentic. According to the 2020 National Customer Rage Survey, one of the primary factors in rage-inducing customer experiences occurs when clients deal with poorly written scripts that come off as phony. So be yourself. Finally, conduct calls in a private room. Beyond the information you're giving in your voice messages, you also have to stay aware of your surroundings. Employee gossiping is one of the leading causes of HIPAA violations. Thus, oversharing on a voicemail could lead to a breach and a hefty fine. So keep location in the top frame of mind when you're getting ready to call your patients. Even if you're not the person who calls the clients regarding their upcoming appointment, the risk involved has an immediate impact on your organization. As a result, designate an area where your phone calls can be made in order to keep eavesdropping to a minimum. As I'm sure you know, nothing in healthcare is as simple as it sounds. If you were in any other industry, you could just call your client and tell them everything they need to know in the message. In your industry though, you and your employees have to stay constantly aware of any information disclosures due to HIPAA. Yet just because it isn't as simple in your industry doesn't mean it has to be difficult. A script, genuine tone, and a designated room are all you need when leaving HIPAA-compliant voicemails. If you'd like to learn more about how to leave HIPAA-compliant voicemails, reach out to eTactics. And you already made it this far into the video, so you might as well like it, share it, and comment below. Well, what are you waiting for? Subscribe to our YouTube channel.